And welcome to today's masterclass hosted by Sleep Play. It's on a really important topic that a lot of us CPAP users struggle with, either when we're first starting out or sometimes inexplicably after we've been on CPAP therapy for a while, and it's talking about overcoming CPAP mask anxiety. My name is Kristen Cassio. I'm going to be presenting this for you all today. I have a master's in social work that I obtained in 2014, and I am currently licensed as an independent clinical social worker in Massachusetts. So I am trained in clinical mental health and administering mental health interventions. I was also diagnosed with obstructive sleep apnea in 2020 after many years of struggling with unexplained symptoms, and I have been a CPAP user ever since, so almost 5 years. It's important to note that this presentation is for educational purposes only, and it should not be considered a replacement for your medical or mental health care. At the end of the presentation, we are going to review a couple of ways that you can find mental health care in your area. Now, getting started, you may know and be able to have the terminology to verbalize that you're experiencing mask anxiety, but it also is frequently described as feeling claustrophobic or someone's feeling unable to breathe when they have their CPAP mask on. Other indicators that this may be going on for you, or if you find yourself saying, I just can't stand having something on my face, if there's any agitation that you experience when talking about your CPAP adherence, especially if maybe somebody in your life or a treatment provider is trying to problem solve your CPAP use with you, panic when putting on a CPAP mask, and also if you are regularly taking your mask off during the night, you wake up in the morning, you don't know when it happened, but the CPAP mask is on the floor. So don't worry. All of this is common. There are studies that show between 30 all the way up to 65% of individuals that use a CPAP will experience some symptoms of mask-related anxiety during their treatment journey, and it is believed to be more common in women than men. There are a couple of first steps that we want to go through before starting the treatment protocol. First, you always want to ask your doctor to check the pressure settings on your CPAP. If your CPAP pressure is too high, you may be experiencing discomfort that is unrelated to anxiety. Now, if you're just starting out with a CPAP machine, most likely that means that you just had a sleep study, hopefully a few weeks and maximum, hopefully a few months before you got the machine. Now, depending where you are, the waits may be longer than that. More than likely, the pressure settings are going to be accurate on your machine because your doctor uses the data and the results from that sleep study to set the pressure for your treatment. You should still ask them because it's also really important for them to know that you're having some difficulty adjusting to and tolerating the CPAP, but that may not be the underlying issue. If you've been on CPAP for a long time, years, and out of nowhere you're starting to feel some of this claustrophobia, anxiety, and ripping the mask off, you definitely want to bring it up to your doctor. Something may have changed in terms of your AHI and what type of pressure you actually need, and it may be time to have another sleep study. I also always recommend when people are starting out, and it helped me tremendously on my CPAP journey, to adjust the ramp settings on your machine. Now, the ramp time on a CPAP machine is the time it takes for your machine to get up to the maximum pressure level. Your CPAP doesn't have to just go straight to the max pressure right when you turn it on. Many machines have ramp times that will set all the way up to 45 minutes. It's a really good option. You want to set it for longer than it typically would take you to fall asleep. So let's say it typically takes you 10 to 15 minutes to fall asleep. You want to set your ramp time to 20 minutes or more. That way, the pressure is slowly increasing as you're falling asleep. By the time it's all the way up to the maximum pressure that was distressing for you, you are already asleep. If these don't help, you may be experiencing some type of CPAP mask anxiety. But there are some things that we can do to counteract this. And what we're going to be going through today is a protocol that you're able to do on your own at home. Of course, if you would like the support of a therapist, we'll talk about how to find one at the end. It's called CPAP desensitization. This was first developed by psychologists Mean and Edinger in 2007. And the treatment is a form of exposure therapy, which is evidence-based to treat anxiety. CPAP desensitization is based in the psychological concept of classical conditioning. If you've ever taken a psychology class, you are familiar with this concept. And most famously, you have heard of it with the experiment of Pavlov's dog. A psychologist trained his dog to salivate at the sound of just a bell. And how he did that was by ringing a bell The bell is what's called a neutral stimulus. On its own, there's nothing attached to that either for a physical or emotional reaction. It's just a bell. He would ring the bell at the same time that he gave his dog the food. And the dog's natural physical reaction to food coming out was to salivate. So he would ring the bell and put out the food, the dog would salivate. He did this over and over and over again. And eventually he removed the food from the equation and just rang the bell, and the dog salivated just to the sound of the bell. So now this neutral stimulus that had no reaction attached to it at first became paired with physiological sensation of salivation as if he was going to be fed. So the same is true for CPAP mask anxiety. Your CPAP mask really is a neutral stimulus. It's just an item. It's just a piece of medical equipment made of silicone wear at night. There's really inherently nothing else attached to it than that. It is neutral. But what happens is wearing the CPAP mask becomes paired with feelings of anxiety. You put the CPAP on, you feel anxious, your brain starts to associate those two things. There's an extinction of anxiety when you take the mask off. And so when the anxiety is not present, it's easier to fall asleep. Let's take this step by step to really see how classical conditioning can contribute to your association of your CPAP mask and feelings of anxiety or distress. So you're trying to be a compliant patient. You know it's important to treat your sleep apnea. So you go to bed for the night, put on your CPAP mask, and turn on your machine. Within maybe instantly, maybe within a few minutes, some feelings of anxiety begin. You may feel that you cannot breathe. You may start breathing more shallow or be hyper focused on your breath. You might have some racing, spiraling thoughts, such as, I'm never going to get used to this mask. This treatment is never going to work for me. So you try to cope for a few minutes. Naturally, that's what we're all going to do. And again, you know how important it is to use the CPAP, which also can add to your distress and your anxious thoughts. If you know this is something that's really important and I just can't make it work, you may be really hard on yourself because of that. So after a few minutes of trying to cope, ultimately the anxiety feels intolerable. You make a decision that you can no longer sit here, try to fall asleep while this anxiety is present. So what do? You take off the mask. Of course you do. And then after you take off the mask, lie back down to go to bed, you find that your anxiety has subsided. And ultimately, you then fall asleep. So what's going on here? In this intervention point right here, between when you take off the mask and the anxiety subsides, the more that occurs, what's happening is your mask in your brain becomes associated or paired with being anxious, feeling anxious, even though it's just a neutral item of a mask. Similarly, this intervention point between when your anxiety subsides and you fall asleep leads your mind to pair the feelings of sleep and the calm associated with sleep to the action of removing your mask. We're going to fall asleep anyway, whether you were tolerating the CPAP mask for longer or whether you never put it on at all. There was a point in time during the night that you were going to fall asleep. What is really happening here in a larger sense is that the more days, the more nights that you're going through this cycle, the more it's getting reinforced in your brain that your CPAP mask equals anxiety and that taking off the CPAP mask equals being able to fall asleep and feeling calm. But what can we do about it? We need to rewire so that over time, your brain is not associating your CPAP mask with anxiety or distress at all. This is a subjective units of distress scale or a SUDS scale. You've probably seen it in doctors' offices as it relates to pain levels. Now, we all have different tolerances for pain, just like we all have different tolerances for the full wide range of emotions. So that's why it's subjective. This is something that only you are going to be able to define. So at each phase in the desensitization protocol, I want you to measure your distress on a scale of 1 to 10. I want you to move on to the next phase in the protocol when your SUDS level is consistently a 3 to 4 or lower. We're not shooting for a 1 because that's not realistic. That's not real life. And if at any phase of the protocol, your distress level is over a 4, even just once, you're going to go back to the previous step in the protocol because there's something between those steps that wasn't quite repaired in your brain, that there is still some anxiety being caused. The first phase of the CPAP desensitization is really to become comfortable with your CPAP during the day. And you've probably heard people recommend this. We say it a lot when people are first starting out CPAP therapy, just wear it around the house before you go to bed. And this is, one example for why that can be really helpful. Particularly if you've tried it a couple of times already and you're feeling really anxious or claustrophobic, we need to just start back from scratch. So what you're going to do is hold your CPAP mask over your nose or over your mouth, whichever version you have, and turn the airflow on. You are not going to fasten it completely. You're just holding it so that you feel like you have a little bit more control over when that mask is on and if you need to take it off. We want you to do this outside of your bedroom and outside of your bed. So sitting in a chair, sitting on the couch. Don't want you to be in your room, in your bed, because right now you've only worn your CPAP when you try to go to sleep. So that can get pulled in. The bed can get pulled into that anxiety connection as well. So this start out really slow. We're looking for progress, not perfection in every single one of these. So do up to 1 to 5 minutes until you can build up time. This piece I really will leave up to you for how long you want to do this for, because some people naturally don't feel distressed at this stage. It's just when they try to wear it longer or in different circumstances. But we really want you to start here just so you can really understand what is your baseline tolerance for this CPAP machine. When you're able to consistently do this, your scale is a 3, 4, or lower, you're ready to move on to the next. But we still in phase 2 are trying to become comfortable with CPAP during the day. But now this time we want to wear the CPAP mask fully, secure it with the straps on instead of just holding it up to you. Really wear it. And similarly, during the day, not in your bed or not in your room, sitting up somewhere else in your house, and turn the airflow on. We want to increase time every day. Start with, maybe 5, 10 minutes, whatever you think you can tolerate, and build up to 15 to 20 minutes. When you get to the 15 to 20-minute point and you're feeling that your distress is not any more than a 4, move on now to the next phase. Now we're going to become comfortable with CPAP while sleeping. But we're going to first start out by taking a daytime nap with the CPAP machine. We're still getting our body used to utilizing this medical equipment. So we want you to take a daytime nap with your CPAP machine, anywhere from 15 to 30 minutes for a nap. This one you can do in your bed. If you have not assessed that your bed is also a point of anxiety. It actually doesn't matter if you fall asleep or not during this daytime nap, because really what you're doing is learning to rest, learning to get into that physical and physiological state of rest with your CPAP on without any distress. Phase 4, you're going to actually wear your CPAP at night. So you're ready to start out at night going to sleep with your CPAP machine. And small periods of time are fine at first, whatever you are able to tolerate. But if you find that taking it off while you're asleep is still an issue, there's a couple of things that you can try. One, wait until you're sleepy to go to bed. And sleepy means you have the propensity to fall asleep quickly. So if typically you go into your room and it takes you 10 to 15 minutes to go to bed, that's actually normal. That's how long we want it to take somebody to fall asleep when they're in their bed under normal circumstances. But if you're having difficulty with your CPAP and maybe once you fall asleep, you pull it right off when you get into that first phase of sleep without really realizing, wait until you are sleepy to go to bed. Sleepy means you're on the couch, your eyes are closing, you really can't keep yourself awake any longer. That's the time to go to bed. You also can try adjusting the point in your sleep cycle when you start your CPAP. Now, the ideal goal is you're going to put it on right when you go to bed and you're going to wear it all night. But if that's not the point where we're at right now, that is okay. What we know about, sleep cycles is that, in the second half of the night is when you're more likely to be in those really deep phases of sleep. So that can be the intervention point that you're targeting to really focus on wearing your CPAP during those times. So if you know that you typically wake up at 2 a.m. or at a certain time during the night, you can go to sleep without the CPAP, knowing that you're going to wake up And when you wake up to go to the bathroom, you can even put it on the sink next to the bathroom. I got up to go to the bathroom. Now I'm putting on my CPAP and I'm going to go to sleep. Or you can set an alarm. The alarm goes off, just put on the mask. You in the second half of the night are hopefully already or very close to the very deep phases of sleep. So you're hopefully just going to knock right back out before you even realize what's happened, before you even realize that you have that CPAP machine on. This is one method that you can utilize to try to overcome the feelings of claustrophobia or anxiety, but CPAP can be a really challenging therapy for a lot of people. So if you're looking for additional support, either to take you through this exposure protocol or just to talk through your treatment or maybe how to cope with the new diagnosis that you have, everything that comes with coping with change, there are ways to get connected with a therapist. I always recommend that people ask their primary care physician or their sleep physician for a referral to a therapist. Particularly, your sleep physician may already know some people in the area that do this specialized type of work or have enough knowledge about sleep disorders and CPAPs to be able to really customize an approach with you. If you work someplace that offers employee benefits, most of those will include an employee assistance program or an EAP. EAPs are fantastic benefits that are confidential, separate from your employer, and they provide a certain number of free therapy sessions. And they also can provide referrals to treatment for longer term use. So they would be able to help you find somebody specific to what you're looking for that's taking on new referrals. There are also online provider directories. The Society of Behavioral Sleep Medicine and Psychology Today are really great places to start. You can filter through your insurance, your location, and the types of issues that you're looking to address in therapy. Don't forget that Sleep Play is here to help. They really care about your overall customer experience, not just with the products that you purchase from them, but in your sleep health journey and your CPAP journey in general. Their CPAP experts can help you with some of the things that we talked about here, adjusting your mask for ideal comfort, recommending different masks based on your preferences, and adjusting CPAP pressure. So if you would like to get in touch with Sleep Play for more information, you can give them a call or live chat them at sleepplay.com. And I hope that this has been helpful for you. Let us know below if there's anything that you've tried in here that has worked for you, if you learned anything new through this, if you're going to try anything out, and if there's anything else you'd like to see from us. And I hope you all take care.